Welcome to Surgical Hack Lectures, and today's topic is appendicitis. So, what is appendicitis? Appendicitis is the inflammation of the appendix, and as you know, the appendix is a hollow organ that is attached to the cecum. So, this positioning of the appendix can be retrocecal, it can be pelvic, but it doesn't matter for this lecture. What's more important is the inflammation of this appendix. So appendicitis, the inflammation of appendix. As you know, itis in Latin means inflammation. So let's talk a little bit about the pathophysiology of appendicitis. What happens that this organ becomes inflamed? So the pathophysiology. Again, you have the appendix. Again, you have the appendix. I'll use a view marker. Let's just imagine this is an image of the appendix. And it has... So this appendix is like a bigger image of it. So what happens with the appendix? That it becomes inflamed. So the appendix becomes inflamed when something, for some strange reasons, gets into the lumen of the appendix. And this causes a blockage or an obstruction here. So when you have the obstruction leads to what? It leads to increase in pressure. Increase in pressure leads to what? It leads to inflammation. Inflammation. As you know, inflammation, itis in Latin. Inflammation leads to what? Inflammation will lead to thrombosis of vessels, and thrombosis of vessels will lead to necrosis. So this is a brief about what happens. So there's an obstruction, it leads to pressure, inflammation, thrombosis, and necrosis. Next, we have to discuss what can cause this blockage. So next we'll discuss what can cause the blockage. So we've talked about the pathophysiology, straight. So causes of appendicitis, the causes of appendicitis, causes. Well, the thing that can cause appendicitis, number one, we can have obstruction by fecalities. Fecalities. What are fecalities? Fecalities are calcified feces. Calcified feces, they are called fecalities. So when the feces stays in the bowel and it becomes calcified, it becomes like a stone. So it can go here and cause what? The blockage of this hollow part of the appendix, and then the whole cycle will start, which is increasing pressure, inflammation, thrombosis of vessels, and well, necrosis. So fecalities. Another thing that can cause that can provoke appendicitis will be foreign bodies, like bezoars. Another point to note, it can also be provoked by intestinal worms. Also, we can have trauma. And last but not least, tumors. So all these can lead to what? they can lead to the obstruction. They can lead to the obstruction and consequent inflammation of the appendix. Having said that, we have to progress. So let's talk briefly about the signs and symptoms, S and S, of appendicitis. Signs and symptoms of appendicitis. So we have, when a patient comes to you, they will complain of pain. And the pain is abdominal pain. So abdominal pain. They will complain of abdominal pain. The patients will tell you they have nausea. And sometimes vomiting. Your patients will complain of vomiting. And of course, subfebrile temperature. So these are classical signs and symptoms the patient will come to you with. However, put into consideration that most times, or in quite a number of cases, the patients will come with maybe just one of these signs and symptoms, maybe just two. But expect these classical signs and symptoms in patients with appendicitis. So now we will talk about the diagnosis of appendicitis. So how do we diagnose appendicitis? Diagnosis of appendicitis. So this I will group into three. The first will be your physical examination. Physical examination, I will abbreviate as exam. Next we talk about the laboratory examination. Exam. And then last but not least will be imaging. The trick is that in a lot of hospitals you may not have the opportunity, or in some parts of the world, or in some circumstances you may not have the opportunity to have the laboratory equipment or the imaging techniques to be able to examine these patients. So we have to lay emphasis on physical examination, because with good physical examination you can actually diagnose appendicitis. So physical examination. As we talked earlier, the patients with appendicitis will tell you about abdominal pain. So let's draw the quadrants of the abdomen. Here we go. Here you have your umbilicus. Well, you've got this and something like the pelvis here. So here is your umbilicus. So abdominal pain. Abdominal pain. So you have to pay close attention and ask this patient where the first pain was felt. In a lot of cases, or in some cases, these patients will tell you that this pain, they felt it first at the umbilical region, and now the pain, afterwards, the pain migrated to the right iliac fossa. So this migration of pain is called the Koch's sign. Koch's sign. It's quite specific, so you have to take note if the patient has positive Koch's sign. Another thing is you can tell these patients to lie supine on their back, and you start the palpation from the left iliac fossa. So you're going counterclockwise, So you're palpating the abdomen from the left iliac fossa to the left lumbar to the left hypochondric. And while you palpate, the patient feels the pain more at the right iliac fossa. So this is called a Rothschild Rovsing sign. Sorry. So this is called the Rovsing sign. Rovsing sign. Again, you can tell this patient to cough. So if the patient coughs really hard, they will feel the pain at the right iliac fossa. So they will feel the pain somewhere here. And that is called the Dunphy's sign. Dunphy's sign. Another sign you have to look out for is you can tell this patient to lie supine and tell the patient to extend the hip, the right hip. Now, if the patient extends, they will feel pain in the right iliac fossa, and that is called the psoas sign. Sometimes you can actually try to flex the hip by yourself, and the patient will complain of pain here. And another one you can add to the list is called the hamburger sign. As we talked earlier about the signs and symptoms, we talked about these patients having nausea or vomiting. So hamburger sign. Hamburger sign simply means offer these patients food and they will say, no, I don't want to eat. So Koch's, Rovsing, Dunphy's, psoas, and hamburger sign. There are a lot of them, but this is actually enough for you to remember. If you can remember 1, 2, 3, 4, 5, it's perfect. It's not bad. You mustn't remember all of them. So this is about the physical examination. Also, don't forget good anamnesis, because you may have other causes for other pathological situation that may mimic appendicitis, but we will talk about that later. So we've talked about abdominal pain. So next will be laboratory examination. We'll talk about the laboratory examination. So lab exam. For all patients, just like for all patients, you have to order CBC, this complete blood count. So when you order CBC, you look out for increased white blood cells, and it's clinically known as leukocytosis. However, in a lot of cases of appendicitis, the leukocytes can be normal. So it can be slightly increased or normal. And you have to also look out for your ESR, it's erythrocyte sedimentation rate. It's number 1 for your lab. And what if the patient is a female patient? You may want to order for beta HCG. So beta HCG will rule out pregnancy because it might be ectopic pregnancy mimicking appendicitis. If you have time and resources, you can go ahead to order urine analysis. If you have, you can also liver biochemistry to rule out other causes of abdominal pain that might mimic appendicitis. Once you've done with all this, we will talk about imaging. Next will be imaging. Lab exam, and next will be imaging. About imaging, so you order for this patient to undergo a CT scan. CT scan is not readily available in a lot of hospitals. So you can go for, actually you should start with ultrasound. Abdominal ultrasound. With ultrasound, you can see changes in the appendix if the appendix is inflamed, and you can also rule out other abdominal pathologies. After your CT scan, you should order CT scan for, after your ultrasound, you should order CT scan for these patients. So CT scan, and with CT scan, it's quite specific and sensitive to appendicitis. You can see the changes in the appendix, and you can also rule out other colonic problems like some cancer, tumor of the cecum or ascending colon, or some perforation or whatever. So ultrasound and CT scan. So when you finish all this, let us imagine that indeed your patient has appendicitis. So how do we treat appendicitis? I'll quickly draw so let's imagine that after all your examination, this patient indeed has appendicitis. How do you treat? Treatment. How do you treat appendicitis? Well, the treatment of appendicitis depends on the severity of the appendicitis. It depends on severity. So if your patient has, and I will divide this into two, here we will have uncomplicated, complicated case. So if the case of appendicitis is not complicated, you will go straight to appendectomy. So this is the surgical removal of the appendix, and this can be done openly or laparoscopically. We have to talk about the complications of appendicitis. Complication of appendicitis. The first and most common complication of appendicitis is the rupture or perforation. So the rupture or perforation of the appendix. What happens is that if nothing is done, the inflammatory process continues and this appendix will rupture. And when it ruptures, its contents will spread across or all over the abdominal cavity. And this will lead to a clinical state called peritonitis. So the patient will have generalized abdominal pain. And for peritonitis, you know, the sign is called the Schottky-Blumberg. That is when you press deeply into the abdomen and release, and the patient will feel pain once you release your hand from the patient's abdomen. That's peritonitis. And if nothing is done with peritonitis, it will progress to sepsis. And if nothing is done, the patient will die. So it will lead to the death of the patient. The second complication that you have to watch out for is abscess formation. So second will be abscess formation. What happens is this appendix, the inflammatory process may lead to the walling off of the appendix. So a pocket with pores and bacteria is formed. And in this case, the treatment is different. So in the case of rupture or perforation of the appendix, you have to go straight to surgery and perform appendectomy and sanation of the abdominal cavity. And at the end of the surgery, you have to put a drain. But in the case of abscess formation, these patients are mostly in a critical condition and you wouldn't want to perform appendectomy instantly. So what you have to do in this patient is you have to drain this abscess. So abscess drainage, you have to put a tube here and drain this abscess. At the same time, for this patient, you have to give them aggressive, so abscess drainage. So to take care of this, you have to drain. You have to put this patient on antibiotics. And you have to treat other symptoms. So if the patient has like fever, you have to give antipyretics. And if the patient is in pain, you have to, of course, give painkillers. So when this is resolved, you can now take this patient to the operation room and operate this patient. So this is briefly what you need to know and remember about appendicitis. Now we have to talk about the differential diagnosis of appendicitis. There are a lot of pathological conditions that can mimic appendicitis, so it's good for us to know some of those. Number one, we will talk about Merkel's diverticulum. Merkel's diverticulum. Two, we will talk about rupture of ectopic pregnancy. Three, we will talk about rupture of ovarian cyst. We will talk about perforation of gastric or duodenal ulcer. Acute pancreatitis. We will talk about tumors or perforation of tumors. So Merkel's diverticulum, this is a different topic, we will talk about it. And rupture of ectopic pregnancy will be a topic on its own. And we can also add acute cholecystitis to the list. We can add more diverticulitis, and so on and so forth. But these are the most common, and for the brief knowledge of what appendicitis is and what to expect in the case of appendicitis, you should remember at least these 8 diseases. Thank you for your attention, and I hope you enjoyed the lecture. If you did, please put a like, subscribe, and share with your friends. Thank you.